You feel a bit of tingling, maybe a burning sensation down your arm or leg. You think it's nothing serious, maybe I slept funny. But what if that mild irritation was actually a nerve asking for help? What happens when a nerve is pinched and you ignore it? Let's walk through stages from the first warning signs to what happens if the pressure never goes away. Hi, I'm Dr. Arvind Kulkarni. I'm a consultant spine surgeon with a focus on minimal invasive and endoscopic spine surgery. In this video, I'll explain what a pinched nerve really is, what causes it in the spine, how symptoms start and how they progress, when damage becomes permanent, and how we treat it at different stages using modern nerve sparing techniques. What is a pinched nerve? A pinched nerve happens when something, usually a bulging disc, bony spur, or ligament thickening, compresses a nerve as it leaves your spinal canal. That pressure blocks signals traveling normally between your brain and the body. It's like stepping on a garden hose. At first, the water inflow just slows down, but if you keep the pressure on, the hose, or in this case the nerve, starts to suffer permanent damage. What does it feel like at first? In the early stages, you may feel tingling in your fingers or toes, burning pain down one arm or leg, pins and needle sensation, intermittent numbness, mild weakness when gripping or walking. At this point, the nerve is irritated but still alive and fully recoverable if treated early. So when a nerve is compressed for weeks to months, symptoms can escalate. Numbness becomes constant, weakness worsens, you may drop objects or trip while walking, reflexes become slow, pain may spread or become more intense. Eventually the nerve starts to lose its insulation, that is myelin, and then the nerve fiber itself begins to degenerate. At this point, even surgical decompression may not restore full function. And if the spinal cord is compressed, in the neck for example, the stakes are even higher. Paralysis, balance, bladder control, coordination, fine motor skills can all be affected. So what to do? When to take action? Here is when you should stop waiting and seek a spine evaluation. Pain that lasts for more than 4 weeks, numbness that doesn't go away, weakness in the grip, foot or leg, loss of coordination or balance, any bladder or bowel complaints, then it's an emergency. The earlier we release the pressure, the better are the chances of nerve recovery. And what is the solution? How do we treat pinched nerves? Depending upon the severity and stage, treatment may include physiotherapy and medications in early stages, epidural injections to reduce inflammation. When there are signs of neurological damage like numbness, tingling or weakness, then better look out for surgical solutions. Endoscopic decompression, a minimally invasive way to free the nerve with precision, and MISS fusion or stabilization if there is instability along with compression of the root. Our goal is nerve preservation, to maintain the function of the nerve, not just pain relief. The longer the nerve is compressed, the higher the risk of irreversible damage. Pain is a symptom, numbness is a signal, weakness, that's a warning. A pinched nerve may seem small at first, but if left unattended, it can rob you of movement, strength and even control. Like this video if it helped you understand the real story behind nerve pain. Share it with someone who's been waiting it out, and subscribe for expert level education that's clear, actionable and patient first. I'm Dr. Arvind Kulkarni and I'll see you in the next video.